So the OPERA trial is an independent trial which was sponsored by the OPERA investigators. That is an international collaboration between 3 countries, Argentina, USA, and Italy. The trial was aimed at assessing the efficacy of omega-3 fatty acids in patients undergoing cardiac surgery to prevent atrial fibrillation onset after cardiac surgery. Post-op AFib is a frequent problem in patients undergoing surgery. Approximately 30% of patients have this problem after surgery, and more frequently at day 2 or 3 after the surgery. And this was, as I said before, an international collaboration. We randomized approximately 1,600 patients in this study, and this was the study design. It was a pragmatic design in order to increase the feasibility of the trial. So patients received 8 grams during 4 days before surgery, 3 days, 2 days, or 1 day, in order to increase the number of patients who could be randomized into the study. Patients had to be followed until hospital discharge or day 10 after surgery, whatever came first. And these are the main results of the study. There was no difference in efficacy between the 2 arms. We had 30.7% events in patients randomized to placebo treatment, and 30% events in patients receiving omega-3 PUFA. The p-value was 0.74. This is the secondary endpoint, incidence AFib, and again there was no difference between the 2 arms. And this is for other study endpoints, which were secondary endpoints, which were pre-established in the protocol. It is not, I don't know whether you can read it, but you can see that probably that MACE were reduced, and there was also a significant reduction for artery thromboembolism and death plus artery thromboembolism, but this was just a secondary endpoint. So the primary endpoint was not different between the 2 arms. And similarly, there was also a trend toward reduction for total mortality. The treatment was safe, and you can see that there was no increase in the rate of bleeding in patients taking omega-3 fatty acids. Actually, there was a trend towards a lower risk of bleeding in patients taking the active drug. So conclusions, post-op AFib remains an enigmatic and difficult to prevent complication of cardiac surgery. Entry PUFA was safe and well tolerated during cardiac surgery without evidence of higher bleeding. And this large multinational placebo-controlled trial provides definitive conclusive evidence that perioperative omega-3 fatty acids does not appreciably reduce post-op AFib in the acute setting of cardiac surgery. So this means also that entry PUFA may have a role in other clinical settings, and for instance, an important trial to be done next year will be the assessment of the efficacy of entry PUFA, long-term entry PUFA use in older adults to prevent the onset of atrial fibrillation. Thank you for your attention.
Thank you very much, Dr. Marchioli. And let me just point out that Dr. Dariush Muzaffarian, who's a co-investigator on the OPERA study, is available as well. Dr. Ali Oto from Ankara, Turkey, will be the discussant. He wasn't able to be with us today, but he'll be the discussant for the late-breaking clinical trial when this is presented. So we'll move on to our next trial, which